Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist and it's a new month, so you know what time it is. It is time for our 15 CHT practice questions. Whether you're getting ready to take the exam in November, which if you are, amazing job, best of luck. You are nearing the home stretch. Or if you are prepping to take it in the future, I intend this to be a good study tool for you. If you have missed previous videos or if you're new here, welcome. The way that this will work is we're going to go through 15 practice questions. Feel free to pause the video, take as long as you need. If you're practicing, for the exam, maybe start to work on some pacing as well. Pick your answers. We'll have a pause halfway through, and then I'll go back through the questions and give you the best available answer with the rationale. And that's how it will work. So, but let's go ahead and get into it without further ado. Question 1. Which of the following is true regarding splinting and orthoses for a patient with stage 4 of rheumatoid arthritis? A. Night splinting can prevent potential deformity. B. Splinting can assist in relieving pain and improving comfort at night. C. Splinting should be used full-time to immobilize affected joints. D. Splinting can help to reverse deformities. Question 2. A patient presents to the therapy clinic after a Fuchs injury 6 weeks ago that led to a distal radius fracture. She is making steady gains in digital range of motion and has been cleared to begin wrist range of motion by the doctor recently. The patient now reports increased shoulder pain over the past 2 weeks with active movement and reports that she is now having difficulty putting on her coat and tucking her shirt in behind her back. The likely cause for her onset of shoulder pain is A. Bicipital tendinitis, B. Supraspinatus tear, C. Glenohumeral joint dislocation, D. Adhesive capsulitis. Question 3. In a VZ instability pattern that occurs as an ulnar-sided lesion, which of the following is true? A. The lunate flexes, B. The triquetrum flexes, C. The lunate extends, D. The scaphoid extends. Question 4. In the capillary refill test to assess for compromised vascularity, blanching to the pulp of the finger will occur with pressure, and normal color should return when the pressure is removed within A. 1 second, B. 2 seconds or less, C. 4 seconds or less, D. 10 seconds or less. Question 5. A wound that is covered by eschar is classified as what color? A. Red, B. Yellow, C. White, D. Black. Question 6. A patient has a fingertip wound that will require a flap for larger coverage and to provide length to the tissues to preserve functional pinch. Which of the following flaps would be most appropriate? A. VY advancement, B. Cross finger, C. Lateral arm flap, D. Thenar wad. Question 7. Which of the following is appropriate for a patient to do with the affected side in the protective phase from 0 to 2 weeks following a rotator cuff repair? A. Gentle pendulum exercises, B. Reaching behind the back to tuck in their shirt, C. Brushing their teeth, D. Lifting an object that weighs 3 pounds. Question 8. You are treating a patient postoperatively after a distal biceps tendon rupture. The patient is progressing well and has range of motion measurements of 15 degrees to 120 degrees and reports sensory disturbance on the lateral side of the forearm. Which nerve is likely causing the paresthesias? A. The medial antebrachial cutaneous nerve, B. The radial nerve, C. The posterior interosseous nerve, or D. The lateral antebrachial cutaneous nerve. Question 9. Which of the following is not an extrinsic ligament of the wrist? A. The lunate triquetrum interosseous ligament, B, the dorsal radiocarpal ligament, C, the palmar ulnocarpal ligament, or D, the palmar radiocarpal ligament. Question 10. Which of the following surgical interventions for fracture fixation requires minimal exposure but provides relatively weak fixation? A, Kirschner wires, B, plates and screws, C, interosseous wires, D, external fixation. Question 11. During your range of motion assessment, you notice that when a patient attempts to do composite thumb flexion, their index DIP also flexes on their left hand. What does this indicate? A, Lindbergh-Comstock syndrome, B, Lynch-Scheid syndrome, C, Martin-Gruber anastomosis, D, quadriga effect. Question 12. If a patient has an injury to the flexor tendon of the ring finger at zone 3, which anatomical region is involved? A, from the A1 pulley to the FDS insertion, B, from the insertion of the FDS to the distal fingertip, C, from the proximal transverse carpal ligament to the distal edge of the transverse carpal ligament, or D, from the distal transverse carpal ligament to the proximal A1 pulley. Question 13. Which of the following best describes a nerve allograft, a surgical procedure for peripheral nerve injury? A, using a sensory nerve to bridge a nerve gap. B, using a cadaver donor material to bridge a nerve gap. C, using a local motor nerve to reinnervate a critical nerve. D, using a commercially available tube to bridge a nerve gap. Question 14. How can a therapist test for suspected ulnar abutment? A, press test. B, gripping rotary impaction test. C, ulnar compression test. D, shuck test. Question 15. A patient presents with an A4 pulley rupture sustained while rock climbing. Which orthosis would be most effective? A, wrist cock-up orthosis, B, PAP extension orthosis, C, relative motion orthosis, D, pulley ring orthosis. Congratulations! You guys made it through 15 CHT practice questions. Now is the time where you want to pause the video here, make sure that you go back through your question and answers, make sure that you feel confident in your choice. Stick to it, commit to it, and let's go ahead and go back through the questions. We'll go through the best available answer and the rationale behind that. Question 1, the correct answer here is B. So night splinting to prevent potential deformity, probably not going to be as helpful in stage 4. That might be more helpful if they're in stage 1 or 2. Full-time immobilization, typically not recommended because we want movement and use of the hands, and motion is lotion. And then to reverse deformities, so stage 4, not going to reverse deformity at that stage. Question 2, the best possible answer here is D, adhesive capsulitis. Just based on the client history, they had a foosh, which is, common for people to develop secondary frozen shoulder. It didn't happen instantly. It's been a few weeks. They're having increasing pain with active movement. It sounds like they're starting to lose range of motion, especially with that internal rotation position, or external rotation, abduction. So that is really, with all of those collective symptoms, probably the best answer. Question 3, the best answer here is A. The lunate will flex in a VC wrist because there is a lunotriquetral injury. So when you think about if the scaphoid is holding hands with the lunate and the lunate is holding hands with the triquetrum, we know that the scaphoid always wants to flex, the triquetrum always wants to extend. So if you think about a VC instability pattern, the LT bridge, they've let go of each other's hands. And so what's going to happen to the lunate? It's going to flex forward with the scaphoid, which is the hand that it's still holding. Question 4, the correct answer is B. This is a good opportunity to review those special tests like the capillary refill test, Allen's test, any of those vascular special tests that you may want to review. Question 5, correct answer is D, a black wound. Time to go back and review those wound colors. Red is associated with a healthy granular wound with healthy granular tissue. Yellow wounds often are categorized by slough, and then black would be eschar. Question 6, correct answer here is A. The VY advancement would best preserve functional pinch. Crossfinger and thenar flaps are more going to help with soft tissue defects of a more proximal area rather than the fingertip to preserve length. Question 7, correct answer is A. If you missed this question, I would look back at the top 10 forbidden activities after rotator cuff repair. Things included on that list include like lifting a glass of water, lifting or carrying over 1 pound, brushing your teeth, washing your back, and anything behind the back with internal rotation, like tucking in a shirt. Question 8, the correct answer here is D. This is a good opportunity to look at your dermatomal areas, the dermatome regions. That lateral antebrachial cutaneous nerve is fairly commonly affected or irritated during the distal biceps repair. And so, that's just a good one to kind of review. If it was the posterior interosseous nerve, we wouldn't really get sensory disturbances, right? Because that's a motor-only nerve. Radial nerve is going to have a different dermatomal region, as is the medial antebrachial cutaneous nerve. Question 9. Correct answer here is A. Extrinsic ligaments are going to connect between the radius and the carpals or the ulna and the carpals, meaning that it's extrinsic to the carpals. Intrinsic ligaments are going to be between the carpals. So of all the choices here, the only one that is not between the radius and carpals or the ulna and carpals is the lunate triquetrum interosseous. Question 10, the correct answer here would be A, the Kirschner wires. When you think about this question, I would just sort of envision what each of these fixation types looks like, knowing the amount of exposure that it takes, right? Like plates and screws are going to require a larger incision. External fixation is going to provide traction to prevent shortening. So just some things to think about there. Question 11, correct answer here is A, Lindbergh-Comstock. Lynch-Shade syndrome is actually not a syndrome, it's a stress test for the TFCC and LT, so that was a trick right there. Martin Gruber is the anastomosis crossover between median to ulnar motor nerve fibers in the forearm, and then quadriga is the effect of a flexion lag in fingers that are adjacent to a finger with a shortened FDP tendon. Question 12, correct answer is D. The first answer here is zone 2, the A1 pulley to the FDS insertion. From the FDS insertion to the distal fingertip is going to be zone 1, and then across from the proximal to distal edge of the transverse carpal ligament is zone 4. Question 13, correct answer is B, with a cadaver donor. Using a sensory nerve to bridge the nerve graft. Wow. To bridge the nerve gap would be a nerve autograft coming from yourself. And then option D is a nerve tube. Question 14, correct answer is B, the grit test. For this, you would perform the grip in pronation, supination, and neutral, and then calculate the grit ratio by dividing the supinated grip by the pronated grip. If the number is greater than 1, it is a positive test for ulnar abutment. Question 15, the correct orthosis for a pulley rupture would be a pulley ring orthosis, which probably is a giveaway because pulley is in the name. But good nonetheless. In my clinic, we see a lot of rock climbers. I don't know if that's true where you are currently practicing, but We definitely make quite a few of these pulley rupture, pulley ring orthoses. All right, we made it to the end. If you made it all the way through this video, all the way through all 15 questions and the rationale, you are truly the one and only MVP. Thank you for staying with me for this long. I hope this video was helpful. Good luck with your studying CHT prep journey. If you enjoyed the video, please give it a thumbs up. Let me know comments below how you'd like to see future CHT prep videos go. If you like the format, if you would like a different kind of format, suggestions, comments, all that good stuff. I love to hear it. And make sure that you are subscribed to Forward Therapy so you don't miss any more CHT prep or other hand therapy related videos. And I will see you in the next one. Thank you for watching.